This is the big one, because women ask me every single day, should I do hormone replacement therapy or should I go the functional medicine route? And the answer isn't what either side wants you to hear. My name is Zhana Tarjev. I'm a family nurse practitioner with Hashimoto's. I can prescribe hormones, and I also practice functional medicine. I live in both worlds. And today I'm going to tell you what I'd actually choose if I were navigating perimenopause myself. Let me give you the clearest explanation of hormone replacement therapy you've probably ever heard. Hormone replacement therapy replaces what your ovaries used to make. That's it. Estrogen, usually estradiol, often progesterone, to protect the uterus if you still have one, and for other benefits, for the bone health, skin health. Sometimes testosterone, for motivation, ambition, libido, and other reasons. It's replacement, not repair. It doesn't ask why your hormones dropped. It puts them back. And for many women, that's enough. It stops hot flashes. It protects bone density. It supports brain function. It can improve sleep, mood, and quality of life dramatically, sometimes within days. The data is clear. For most women under 60, within 10 years of menopause or even older, the benefits of HRT outweigh the risks. As for the breast cancer risk, please read the book Estrogen Matters, written by the oncologist Dr. Avram Bloomin, and the protective benefits for bone and brain are significant. HRT is not the enemy, it's a tool, and a very good one. Now let me tell you what functional medicine does differently. Functional medicine doesn't just ask what's low, it asks why is it low? It looks upstream. What drove the hormonal decline? Is there a chronic inflammation, autoimmune activity, gut dysfunction, blood sugar dysregulation, adrenal burnout, environmental toxin exposure? The functional approach tests more deeply full thyroid panels, adrenal function, nutrient levels, gut health, detoxification pathways. And it addresses those root causes through diet, lifestyle, targeted supplementation, and stress management. But here's what I need to be honest about. None of that replaces estrogen. If your ovaries are in perimenopause or menopause, addressing root causes supports your overall health, but it doesn't bring your estradiol back to premenstrual levels. You can eat perfectly, manage stress beautifully, and take every supplement on Mother Earth. And you may still need estrogen if your symptoms are significant. Functional medicine and HRT are not enemies. They answer different questions. Now I want to get personal, because this is where my credentials and my lived experience come together. I have Hashimoto's thyroiditis, diagnosed over 10 years ago. For me, the question was never HRT or functional medicine. It's like asking thyroid hormone or functional medicine. If you're deficient in thyroid hormone, I'm gonna suggest to replenish your thyroid hormone. It was always both. Why? Because Hashimoto's is an autoimmune condition. My immune system attacks my thyroid. If I only took thyroid hormone replacement and ignored the autoimmunity, ignored the inflammation, the gut health, the food triggers, the stress, I'd be treating the downstream effect while the upstream fire kept burning. On the other hand, if I only did functional medicine, cleaned up my diet, addressed my gut, managed my stress, and refused thyroid medication, I'd be making myself suffer unnecessarily. And it actually could be dangerous. My TSH was 250 at the time of flare, which can predispose to the thyroid coma. My thyroid was damaged. I needed placement. The same logic applies to perimenopause. If your symptoms are severe, if you're not sleeping, your mood is unstable, your brain fog is affecting your work, bioidentical hormones can give you your life back. And while you're on them, you can also address the root causes that will protect your long-term health. It's not either or, it's both and. Don't let anyone tell you there is only one right path. There isn't. There is your path, based on your labs, your symptoms, and your goals. How to actually decide? Here's a framework for making the decision. First, get comprehensive labs. You cannot make this decision blind. You need estradiol, progesterone, testosterone, full thyroid panel, fasting insulin, inflammatory markers like CRP, C-reactive protein, vitamin D, iron, and a 4-point cortisol if fatigue is a symptom. Without data, you are guessing. Second, rate your symptoms. Are your symptoms mild? Some occasional night sweats and mild irritability? You might do well with functional support alone. Are they moderate or too severe? Can't sleep, can't think, mood swings affecting relationships? That's where HRT can be genuinely life-changing. Third, consider your risk factors. Do you have a personal strong family history of hormone-sensitive cancers? That doesn't automatically rule out hormone replacement therapy, but it shapes the conversation. Do you have autoimmune disease? That makes the functional medicine layer more important. Fourth, find a provider who works in both worlds. This is the hardest part, but the most important. You want someone who can prescribe bioidentical hormones and order functional testing and talk to you about diet, lifestyle, and root causes. These providers exist. They are worth finding. Here's my bottom line. If I were in perimenopause right now with my Hashimoto's, I would test everything. I would address inflammation and gut health. And if my symptoms were disrupting my life, I would use bioidentical hormones without guilt. Because functional medicine and hormone therapy are not opposing philosophies. They are complementary tools. And you deserve both. I'm Zhana Tarjev. This is Optimal Health. If this helped you think differently about your options, share it with someone who is struggling with this decision. Drop a comment. Are you on HRT, doing functional medicine, both, or still trying to figure it out?